June is recognized as Men's Mental Health Month, an initiative with the goal of raising awareness around the unique mental health challenges men face. According to the World Health Organization, males die by suicide at twice the rate of females, making up 80% of all suicide cases in the United States. Men are less likely to receive formal mental health support of any kind. Men's mental health is often overlooked due to the societal expectations and traditional gender roles that discourage emotional expression. Many men feel pressured to appear strong and self-reliant, which can lead to the suppression of emotions and reluctancy to seek help. I'm now joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, thank you for joining us today.
Good to be here.
Now, men are known to ignore or avoid their mental health and are reluctant to discuss their struggles. What are signs a male is dealing with a mental health issue?
Right. So your point is absolutely correct there. So it's an important question because the signs might be difficult to seek out. What we do see is behavioral changes, some withdrawal from social activities, sometimes changes in work performance, increased use of alcohol or drugs. We also see some emotional changes, some irritability, anger, and mood swings may persist. Physical symptoms, they might start complaining of aches and pains, fatigue, headaches, and some difficulty with concentrating and with negative thought patterns as well.
Now, mental illness is more common in women, but this is believed to be because men don't open up as much or show different symptoms than women do. How do men's signs of mental illness differ from women's?
Well, it's interesting. If we look at Canadian statistics specifically as well, men account for about 75% of suicides in Canada. So it averages about 50 men per week. We know that Canadian men are about 3 times more likely to experience addiction, substance abuse compared to women as well. Certainly there are a lot of similarities, but we do see those differences. Men may show more distress through anger and irritability. Men might engage more with substance abuse. Men might report more physical symptoms like headaches. And then there are coping mechanisms as well. Men tend to use avoidance or distraction for coping. And then we also have help-seeking behavior. Men are less likely in general to seek help due to the stigma.
And do those differences ultimately mean that treatment options differ between men and women?
I think there are likely some small differences in treatment options there. Oftentimes in psychotherapy for men specifically, therapy might involve focusing on developing emotional awareness and managing anger. There are certainly medication considerations there because of different symptom profiles and side effects for issues that might be more important for men. And of course, support systems, so encouraging men to join support networks are very helpful. Finally, we look at lifestyle modification. So if there are things like substance use that might be worsening the issues there, which we see more commonly for men, we certainly tailor that to that individual.
There is the stereotype around men being seen as weak if they cry or show any sort of vulnerable emotion. What are ways that society can break that man up or boys don't cry mentality?
I think that's very tough. I think it's going to take a huge cultural shift and probably a quick history lesson as well, because until the 1800s, men weeping and the ability to have these deep emotion was actually seen as a sign of devotion and chivalry. And you can actually see these in historic works when you visit museums. But since then, things have changed considerably, and I think we have a long way to go in breaking the stereotype. Looking at parenting and family influence will really be the greatest effect for our generation, along with role models and really supportive environments and media, such as yourself, shedding light on these important issues.
Now, you've talked about supportive environments and media, but what are some other tips to help men avoid or get through struggling from mental illness?
I think the biggest tip I can give is that men should recognize that you're not alone. You don't have to feel that way. And really seeking professional help can make a huge impact for you and your family as well. Therapy makes great advances in this. Medications and antidepressants have really transformed mental health treatment and made a tremendous differences in the lives of my patients and other patients as well. And aside from that, just open communication with your family, staying connected to your friends does make a strong and lasting impact for your mental health.
Dr. Raut, thank you so much.
Thanks so much for having me.